Good morning.
Good morning.
Well, today's the day. You all set?
I guess.
Okay, good. Well, today you're going to have a beautiful experience. Everything we're going to accomplish what we talked about.
All right. I've decided that this is a great journalistic opportunity for me. A lot of people don't like to talk about these procedures, but it's kind of what I do, so it really doesn't bother me. If you're curious, if you've been thinking about this yourself, I'm willing to put myself out there and show you exactly what to expect if you decide to do cosmetic surgery. Yeah, just go like, show me exactly what you're gonna do. Just
well, when we discussed everything in the past, your biggest concern was your neck, and what other things that I see is that you already had your eyes done, your upper eyelids, and even though that was done, you still have a little bit of hooding and a little bit of a tired look. So we're going to correct that with an endoscopic brow lift.
Okay.
Which means no major incisions, just 3 tiny incisions where we're going to elevate the brow, and we'll get rid of these frown lines pretty much forever.
Oh, good.
And no more Botox in this area, and the distortion of the hairline that you see with the other techniques is not going to be there. So your hairline will be exactly the same. You're not going to lose any hair. Then with the lower eyelids, you have a little bit of puffiness, so you don't have that much loose skin. So we're going to do a safer procedure, less invasive, where we take out the fat from behind the eyelids, called transconjunctival approach. We'll take out these little fat pockets, and then we'll do the face and neck lift, where we're going to be tightening up all these muscles on the neck and getting rid of all this crepey skin. And we will also be elevating the cheek muscles. And we'll do this all with a very natural looking result. And you will not have any hairline distortion, and you will not have any incisions showing with any hairstyle that you wear.
Wow.
And that's the key thing. It's not how
So where do you put the incisions then?
Well, the incision, instead of, you have a very high sideburn. So you're one of those patients you absolutely cannot make the incision back here, because it'll give you that pulled look. And your sideburn will wind up all the way back here, and when you smile, go ahead, smile, you have that distorted, I had a facelift look.
Right.
So we don't do that technique, and everything is within the hairline, inside the ear, and on the back of the ear. So this way, once that's healed, in a very short time, you will not see anything. And and as far as the skin is concerned, then the next thing we're going to be doing will be fat grafting.
Right.
And we have your beautiful pictures from when you were a youngster. This is your cheerleader pictures.
It's the one where I obviously tore somebody off the other half. I don't remember who that was.
Might be Biff.
Right.
And this is you.
I was
in your 20s.
Yeah.
And you could see how you had a much fuller face, even though you were still a very young, thin girl. And you're still thin, but your face has lost some volume, which is normal. And after you've had children, even in your 30s, you've lost some volume. So we're not going to go back that full, but somewhere in between. Okay. And the advantage of the fat, has some degree of permanency, so we don't overcorrect a tremendous amount, because you do get some good retention, and I don't want to overdo it. It's always easier to put a little bit on later on if you need it.
Oh, you can add more later.
Oh, you can add more later under local anesthesia. It's a very simple procedure.
Oh, that's good to know.
And very rarely do we do that, but once in a while we do add a little bit more.
Okay. And
safety and beauty is first, so this way it's always easier to put some in rather than take it out.
Right.
So the other advantage of fat cells is that not only can we use as much as we need to use, you also have the permanency, and there's also stem cells. So your skin quality will get better, in addition to the other procedures we're doing, just from the fat cells alone, from the stem cells.
Oh, nice bonus.
Yeah. So, and then the final thing is, even though your skin's not bad, you have pretty good skin, considering that you've been living here for a long time, and you told me you're an outdoors person and you enjoy boning. You've taken pretty good care of your skin.
Sunscreen.
But it's very sensitive and very fragile, so you have some sun damage and some pigmentation issues, so the laser will remove that.
So when can I go back on the air?
I would say...
You're going with me when I go back on.
Okay.
You'll be my first.
Oh boy, put pressure on me. Put a lot of pressure on me. But if the surgical part heals very nicely, it's the laser part that sets you back a little bit. But hopefully, within 10 days you could probably go back on there. You still look like you had something, but I'm saying closer to 2 weeks.
Okay.
By 3 weeks you should look good enough for a social event. And then every week after that just gets better and better. But
Okay, I've got the camera down low here so you can see all this stuff underneath my chin and on my neck that is going to be addressed, because I've tried minimally invasive procedures and they've helped somewhat. They've helped for a while, but now it's just gotten to the point where I've got all this stuff under here. I really need to do something surgically. Even the word facelift has negative connotations. Even when I hear that word, I think of the old-fashioned overdone facelifts. So I'm going to try to dispel some of those old notions and some of those ideas that we all have floating around in our heads by showing you exactly what to expect. Okay, thank
Alrighty.
you.
So we're going to have some fun today.
Yeah.